So some of the normal things pre-farrowing, which you guys are probably really accustomed to a lot of this stuff, but it's always a good review. So usually, a week or so prior to the sow farrowing, you start to see some mammary gland enlargement, become more firm, swelling around the vulva. A few days before she's due, their mammary glands become more tense and turgid, and you may secrete a little bit of fluid. Within the day of farrowing, you'll start to get some milk secretion from the mammary glands. The sows themselves, restless, they start nesting. 6 hours prior to farrowing, you start to see a little bit more of abundant milk secretion. A couple hours leading up, sows are laying down, increased respiration rate. She should be quiet, she should be relatively quiet as long as everything is normal. Laying down on her side, seem relatively comfortable. And they were about, a half hour to hour and a half before she started passing piglets, start seeing more straining, passage of some blood-tinged fluid and the meconium. So here's some pictures of that. So as far as piglets being born, other species, the presentation of the piglet is the baby is very important, as most times you want the head coming out first, that sort of thing. With piglets, don't really care too much. I think somebody's done enough research that I think it's almost about 50-50, whether it's head first or I say tail, but first, not super important. The sows themselves should be exhibiting just mildly straining, but otherwise be pretty quiet. They shouldn't look like they're in excessive discomfort or pain. Piglets are born about every 15 to 20 minutes on average, of course. And the total delivery time, a few hours, again, highly variable, depends how many she has, right? The placenta itself is usually delivered about a couple hours after the last pig, but portions of it can be kind of coming out during the farrowing process itself. Signs that of a dystocia or difficult farrowing would be any blood-tinged fluid and meconium that's discharged without signs of straining, excessive straining without the delivery of pigs, the time between the piglets exceeds 30 minutes, any foul smelling, discharge brown or gray in color, anything really dark. And some of this gets a little bit variable, right? Like reddening of the sow's eyes. Sometimes I see that in normal processes, but any sow that looks like it's very much in distress, very rapid breathing, inability to rise, she seems weak, she looks exhausted. Off feed is kind of, it's kind of normal for her to not really eat a lot, maybe the day of, but sometimes people use that as an indicator. I think that's kind of hard to say. And gestation length exceeding 117 days, it kind of gets a little bit variable, right? Obviously it's supposed to be 115 days. I say supposed to be, that's the average, but I would say, consistently, I go to some farms and say, we're always 116, we're always 117, and that just becomes the average at that farm. So certainly some variability in that, but I would say it's more of like what's normal for your particular site or your pigs. So how do we decide if we need to help out a pig? So for me, I'd say about 30 minutes or more. If since she's passed the last one, she hasn't passed another one. Again, you're not always there every minute, so a good indication to me is if the piglet's pretty dry, it's probably been more than 30 minutes. So, obviously they like to do it. She likes to farrow right in the middle of the night or in the early morning, so you're not always there 24/7. So I use that as my good trick. That if she's pretty dry, it's probably been, or the piglet itself's dry, it's probably been more than 30 minutes. So, I'm not terrified if it's 30 minutes, but that's just it's a good standard number to give. But I'm definitely getting more concerned if it's 30 minutes and I haven't seen another pig. Other things that I would select for, so there's blood or fluid behind her and she's been straining to pass a pig for more than 30 minutes. So we'll talk about this more, but some people, once they see this, they just go ahead and give oxytocin. No, that's the big no-no, right? We should never give oxytocin before you palpate, because you don't know what you're giving her oxytocin. There might be a stuck pig in there. We'll discuss this more, but that's not a good situation to be giving oxytocin against a stuck piglet. So having the right tools will always help you get the job done. So for the most part, I think a lot of pigs can be hand delivered on palpation, but having like OB snares, tongs, these are just I've actually broken a couple of these. These aren't my favorite. I don't know if anybody uses these, but I've broken a couple of these. These were the tongs. Again, that's not my personal preference, but some people like those. I like these ones. I think they call it a goat one. It's like a goat and kid one as well, but I kind of like this loop. That's just my personal preference, but it's all about whatever you need to get the job done. But I like those the best. They're like $10, I think. You can get them online. As far as farrowing assistance, so I'm going to try to clean off the vulva and rectum, warm soapy water, using clean OB sleeves, plenty of lubricant, and being gentle and patient, right? So I just kind of cup my fingers as I'm going in and gently insert into the birth canal. Pictures of that. If she's not ready, you're not going to be able to get in there very far. So the canal will be closed. So when you go and you initially kind of go in, you should feel the bones of the pelvis underneath you, and you should be able to move forward. Right? I think she's got 2 horns, right? But I will say from enough experience, and if you guys have palpated enough pigs, you can't always tell what side you're on, or you can't always feel the 2 horns, right? You can't always feel the division. Some of that just depends on the size of the sow, how many pigs are still left in there, that sort of thing. But sometimes you can, sometimes you can't. If I'm having issues with that, or I feel like, I just keep on going up the same side, sometimes I try to get that sow up, move her around a little bit, get her to lay down on the opposite side, so I can feel like I'm getting in the other horn there. This is a diagram of the birth canal here. So the rectum's up here. This is going to be the birth canal, the bladder. So just a visual. Again, our reproductive tract, our 2 horns. In a non-pregnant animal, obviously. But so, okay, we palpated. We're feeling inside. You don't feel a pig. Half cc oxytocin, IM. If no pigs have passed within 30 minutes, I recheck again, and then I give another dose of oxytocin. And I'm kind of repeating that process until the afterbirth is passed. So, you feel in there? I do feel a pig. Okay. So, best case scenario, you can gently pull up in there and just glide that, piglet right out. You leave the sow for 30 minutes. So I let her try to do it on her own. That's what she's supposed to do. It's what she's designed to do. I try to let her push her back on her if she can. So if she has not passed another pig after 30 minutes, again, I palpate her again. If I don't feel anything stuck or I'm not pulling anything else out, I give her a half cc of oxytocin. One of the more common reasons that, she's not passing the pigs. A lot of times I think it's just uterine inertia. It's just too exhausted. She's tired. She's not able to contract. I talked about that. Kind of best case scenario, when you're manually going in there, you can just grab the pig by the face, I want to say by the head. My trick is, or what I like to do lots of times, especially if it's head first, is to use my thumb and pointer finger and open up the pig's mouth. Because the hardest things I think you get in there, you're just slipping. You're constantly slipping. And so you kind of need something to grab onto. And so using the inside of the mouth, the jaw is kind of something to grip onto, I think is really helpful. Obviously, if you're certain the pig's alive, you want to be more gentle. If you're pretty sure it's dead, you can be a little bit more aggressive. And that will help too, because you're sticking your finger in the mouth to see if you got something biting against you. But that gives you a good hook. If you're certain the pig's dead, the other thing that's a good hooking mechanism in a dead piglet would actually be the eyeballs. Put one finger in each eyeball, this thing to grip. So it's just another trick, I would say. So for these breech pigs that you're not, able to get out, especially if it's tail first or, back legs first, finding something to hook under the hind legs. Again, you can use the snare, OB snare, so try to hook onto the legs too if you need it. If it's head first, I'm usually doing it around their neck. Here's showing, yeah, he's using that kind of the same method. He's got his fingers hooked into the jaw there. Any sows that you reach into should be monitored closely, right, for uterine infections, so excessive discharge, the dark, brown, green, anything excessively bloody. As far as treatment goes, Banamine, it's a great drug. It's our friend. 1 cc per 50 pounds is the dose I use on that. A couple days. You can do it for several days in a row, once a day. Usually these girls are uncomfortable, have a lot of inflammation going on, so certainly for pain control, that's helpful. Antibiotic, probably the ones that I reach for, Ceftiofur, maybe like an XNL, Naxel type product. Even Baytril is decent penetration to the uterus there, so sometimes I use that as well. But I just want to talk a little bit about oxytocin because I think there's some kind of common misconceptions about oxytocin. So oxytocin, we use it for milk let down, right? And we use it for uterine contractions. So she's not going to be producing any more than she's got. You're just helping it let down. So high doses are bad. High doses are bad. I can't tell you how many times I go out to farms and people are just nailing girls with oxytocin. More is not better, I promise you. The body is designed to get small, frequent doses of the oxytocin, not large doses. You're going to have negative effects if you do that. So too much is going to cause cramping, uterine exhaustion, probably increase stillborn. So I promise you more is not better. You'll actually shut the receptors down if you start giving too much oxytocin. So again, never give oxytocin without checking for a pig first, without palpating. So if you're causing the uterus to contract against a stuck pig, the pig's probably going to die if it's not already dead. The uterus is going to become exhausted. It's going to be very detrimental to the sow as well. Again, proper dose, 0.5 ml, up to a cc. I can go up to a cc, but that's the dose range. They're usually 0.5 ml is fine. Again, like I talked about, excessive dosage is not a good thing. And we saw this slide last time with the breeding, but again, as far as things we can use for reproductive manipulation, aborting with lutolice and inducing farrowing with lutolice. So to chat about that a little bit, so inducing abortions is not really common in the pig world, but you could use it. Most commonly, it's going to be used to induce farrowing. So the reasons you would use lutolice, so sows with a poor history, right? So sows that have had issues in the past can be induced to farrowing, so that in hopes that you can be there, you can be home to assist her if needed. Sows that have had history of high stillborns in the past, it's probably likely that she's going to have issues again. So certainly an indication there. Also, sows or girls who have not farrowed by 117 should be induced to prevent farrowing complications. Piglets become too big and she can't get them out. So the dosage is 2 mLs on that, 24 to 30 hours before the desired farrowing time. 22 hours after, we should be routinely checking her to make sure to see if she's gone in yet or see if she started farrowing and be able to assist her if needed. Inducing sows too early can have negative effects on the pig, so you shouldn't be inducing at 110 or 112. It's too early. Again, another safety thing for women, especially women of childbearing years, use caution when handling this product. You need to be careful. Or that even some of the big farms say that the women shouldn't be handling it at all.
Here's a quick question. What's the dosage for the high con blue lice?
Oh, I don't know.
My vet just happens to be carrying that.
Yeah.
And not the regular blue lice.
Yeah, that's good. Yeah, the question was the dose for the high concentration. I actually don't know the answer to that because that's the only one we have there at the office. So I'm not.
I emailed you that.
Yeah. Okay, I can. Yep. I can find that. And when I'm going over a lot of these products too, I realize too I'm kind of hitting the big name brand ones. Like there's some generics out there, right? Like there's a generic Matrix. Alternative Chromamate. There's one. Yeah, there's a couple. Yeah. So yeah, I'm talking. I recognize I'm kind of talking about the big name brand ones. Yeah. So yeah, bear in mind there's more out there. There's some generics available with some of this kind of stuff. I'm just kind of hitting the big name ones. So yeah. I think one or two. Lastly, so some people talk about this like calcium to sows, and the reason is they usually have dairy cows too. So, a lot of people think that hypocalcemia might be a thing in sows. There's been a lot of research on it. Nobody can really find it. So, but that being said, some guys will still give it because, I don't know, they think they're doing something, makes them feel better. But, the research has shown when they've done a lot of calcium samples looking at sows, both pre-farrowing and after, calcium levels are pretty darn normal. They don't drop down like they might in other species. And even when they gave calcium in some of these studies, it didn't even really bump up the level. So it doesn't really seem to be doing anything. I think people just liked it, like I said, because they thought it was cheap and they felt like they were doing something. But I don't really think it hurts, but probably not really helping. So just something to see there out in the farms. We did chat about this, the umbilical care. I think I kind of threw that on there. We chatted about that earlier. So that is it. Questions about that or anything that I did not talk about? Which there's a lot. There's a lot to talk about, but there's only so many hours to cover it. So any other issues or hot topics that I didn't answer or we want to chat about, diseases or...
I guess I could ask some questions about feeding, about when you change sows' diets. You change them 2 weeks prior to farrowing, and what protein do you generally go to?
Yeah. So, yeah, the question is regards to feeding and changing the diets, even late gestation. So I'm not going to give you a very good answer, and that's because I'm not a nutritionist. So I always recommend to people to find a quality nutritionist. And I will tell you, feeding programs are vast and varied. Every farm has an opinion about it. And so, to be honest with you, I don't think I have one set protocol on that. Some people bump up feeding, the last couple of weeks of gestation. Some people maintain. People swear by doing one way or the other. Some people are full feed, all through lactation. Some people kind of slow them up the first couple of days, and then people swear by that one way or another. So my crappy answer is that I don't have a great answer for that. And in terms of a protein, I would say to get with your nutritionist on that. I don't have great recommendations. So I know that's a bad answer, but it's the truth.
What about increasing fat for keeping animals warm for the winter? Since you're
We just had that discussion.
Did you?
Pastured animals.
Oh yeah. Well, I guess in theory, I'm not again super well versed on that topic, but it certainly seems like a good idea. It seems like it does make sense. It makes sense to me as well, but. Yeah, as far as the concrete data to say, and doing that's going to give you a good return and it's going to help, I don't have great knowledge on that, Yeah, the people that are really smart in the pig business are veterinarians and nutritionists, but you have to get your PhD to do that, so those are the people that are really knowledgeable, but, yeah. A lot of the big companies have swine nutritionists on staff to kind of handle handle that, topic in and of itself, 'cause that's a whole nother issue, a whole nother topic.
We
It's
have
a
a
big
few,
topic.
one of them's not me.
Oh, do you? Oh, yeah, okay. Yeah. Oh, yeah. That's a big field, so, yeah. We do work with nutritionists some, but I'd say, yeah, and probably need to work with them more, to be honest with you, But, yeah, that's something that I kind of stay out of that field, and I trust the nutritionists are formulating the right diets and then go from there, so, yeah.
Any other
What
questions?
Okay.
All right.
Good. Well, thank you. I
Thank you,
appreciate
Dr.
the
Carroll.
time. Yeah.
Yep.